Good evening, dear students. I am Dr. Rawal, your original guru for dental anatomy and dental histology. Today we will be discussing most important MCQs of dental anatomy and dental histology for your INI CET exam, which will provide an insight into most important topics of dental anatomy and dental histology. So, which are the important topics? For dental histology, we have tooth development, enamel, dentine, pulp, cementum, periodontal ligament, eruption and shedding, bone, and histo techniques. For dental anatomy, you should be thorough with the chronology of deciduous as well as permanent dentation. In our standard book Wheelers, we have a chart for both deciduous as well as permanent dentation. So go through the table and be thorough with the table, because question always comes based on the eruption time, based on the eruption sequence. Next important topic for dental anatomy is difference between deciduous and permanent dentation, characteristic features of individual teeth, which groove is present in which tooth, how many cusps are present, how many roots are present. These are the basic questions. Then we have occlusion. So let's start with today's MCQs. First question is, dental papilla gives rise to, so this question is from tooth development. Most basic and most important topic, will always get a question from this topic. So dental papilla gives rise to pulp only, or is it pulp and dentine, pulp and periodontal ligament, or all of the above? Answer is pulp and dentine. Why pulp and dentine here? Because always remember, dental papilla, D and P. D, dentine, P, pulp. So always remember this DP, dental papilla, will give rise to dentine and pulp. So it is very easy for you to remember dental papilla, DP. DP, dentine and pulp. We have enamel organ. Enamel organ gives rise to what? Enamel. And we have dental sac or dental follicle. This dental sac or dental follicle gives rise to what? It gives rise to three components, three tissues: cementum, periodontal ligament, and alveolar bone. So from the chart given, you can appreciate the formation. So this is enamel organ. Enamel organ will have inner enamel epithelium. This inner enamel epithelium cells will differentiate into which cells? Amyloblast cells. And amyloblast cells will form enamel. Coming to dental papilla. This dental papilla, which we have our question on, dental papilla cells will differentiate into which cells? Odontoblast cells. They will differentiate into odontoblast cells. And this odontoblast cells will give rise to dentine. And we will have undifferentiated mesenchymal cells or fibroblast cells. This fibroblast cells will differentiate into pulp. So dental papilla finally gives rise to dentine and pulp after differentiating it into odontoblast and fibroblast cells. Coming to dental follicle, it will differentiate into cementoblast. This cementoblast cells will form what? Cementum. They will form cementum. Fibroblast cells will form periodontal ligament. And osteoblast, osteo meaning bone, so they will form alveolar bone. So again, from this chart only, we have prepared our 3 to 4 MCQ questions. You can be asked, amyloblast cells form what? So amyloblast cells form enamel. Odontoblast cells form dentin. Which dental tissue is first formed? Dentin or enamel? Dentin. So when the first layer of dentin is laid down, then the inner enamel epithelial cells differentiated into amyloblast will form enamel. This signaling process is known as reciprocal induction because without the influence of inner enamel epithelial cells, dental papilla cells cannot differentiate into odontoblast cells and form dentin. So without the influence of amyloblast cells, dentin cannot form, and without the influence of dentin, enamel cannot be formed. So this is known as reciprocal induction. But the first formed tissue is dentin. And you can also be asked, dental follicles forms what? So it forms cementum, periodontal ligament and alveolar bone. Now coming to next question. So you can be asked image-based questions, you can be asked numerical questions, you can be asked logical reasoning questions. So amongst those, we have this question as image-based question. Identify the structure given in the image. You have to identify the structure given in the image. Which is this structure? Is it gubernacular canals, incisive foramen, canals of Hirschfeld and Zuckerkandel, or Walkman canal? Go through the image. Right answer is gubernacular canals. So what are these gubernacular canals? What's its role? What is its function? This canal mainly have an important function in eruption of tooth. They guide the eruption of permanent teeth. What does it do? Guide eruption of permanent tooth. This can be again asked as an MCQ question. What guides the eruption of permanent tooth? So, gubernacular canal. Gubernacular canal has a soft tissue component which is known as gubernacular cord. So, in the eruption of succedaneous teeth, gubernacular canal and its content, that is gubernacular cord, have influence on eruptive tooth movement. This is mainly connective tissue component. As soon as the deciduous tooth erupt in the oral cavity, what will happen? The tooth jump for the permanent tooth will move apically. This is the permanent tooth. Then our tooth jump will be present apically. It will be covered entirely by bone except for a small canal. This tooth jump will be covered by bone except for a small canal. And this small canal will be containing what? Connective tissue and remnants of dental lamina. This canal is what? Gubernacular canal having soft tissue component, that is gubernacular cord. And it helps in guiding of permanent tooth. So you have seen the image. You might not be having any doubt in this. What guides the eruption of permanent tooth? Gubernacular canal along with the gubernacular cord. Gubernacular cord is mainly the connective tissue portion of the canal. Which of the following transient structure has determining role on shape of the tooth? Transient structures means temporary structures. They are visible during which stage? They are visible during cap stage. They begin to disappear as soon as enamel formation begins. So, which are the options here? Enamel cord, enamel knot, enamel niche, or enamel navel. Correct answer here is enamel knot. It mainly plays an important role in determining the shape of the tooth. Why? Because enamel knot is mainly signaling center. It acts as a signaling center, a reservoir of dividing cells. So enamel knot is what? Reservoir of dividing cells. It is mainly a signaling center. Why it is a signaling center? Because it contains many growth factors responsible for the shape of the tooth. So our answer is enamel knot. So first is enamel knot. Mainly, where is enamel knot present? It is present near the concavity of the cap. In cap stage, we have structure like this, right? So this is the concavity of the cap. Here you can see cluster of cells present. This cluster of cells, densely packed cells near the concavity of the enamel organ, form knob-like extension towards the dental papilla. So they are mainly present at the center of the concavity, knob-like extension projecting towards the dental papilla. Reservoir of dividing cells, and it is signaling center as many growth factors are expressed, and it determines an important function in shape of the tooth. In this diagram, you can appreciate this is enamel knot, 5 number. Then coming to enamel cord. What is enamel cord? It is again a transient structure. Vertical extension of enamel knot running across the enamel organ. Then comes our enamel septum. When the enamel cord meets the outer enamel epithelium, it is enamel septum. And when it meets the outer enamel epithelium, a small depression will be present. That is enamel navel. So in this diagram, you can appreciate this extension is enamel cord. 6 number is our enamel cord. Then comes enamel navel. When this enamel cord reaches, this is outer enamel epithelial portion. So when it reaches outer enamel epithelium, it forms enamel septum. And when a depression will be present, it will be navel. Now coming to next question. Which gene is involved in dental mineralization? Which gene is involved in dentin mineralization? MAP1B gene, AMEL gene, PEX gene, or PAX gene? So correct answer is PEX gene. PHEX. Many genes are involved in dentinogenesis, but the most newly discovered genes are MAP1B and PEX gene. MAP1B is mainly involved in odontoblastic differentiation. Remember this. This can again come as an MCQ question. Here we are given what? Question is what? Which gene is involved in dentin mineralization? In spite of this, you can sometimes be asked which gene is involved in odontoblastic differentiation. So remember, MAP1B gene for odontoblast differentiation and PEX gene for dentin mineralization. Right? MAP1B for odontoblast differentiation and PEX gene for dentin mineralization. Next question. Mesiolingual developmental groove is present in, is it permanent mandibular first premolar, permanent mandibular second premolar, permanent maxillary second premolar, or permanent maxillary first premolar? Correct answer is what is the correct answer here? Permanent mandibular first premolar. permanent mandibular first premolar is the correct answer. So remember mesiolingual depression. What is this mesiolingual depression? In this diagram, you can appreciate this depression. This is mesiolingual depression. It is mainly separating what? Mesiobuccal lobe and the lingual lobe. And mainly present on lingual surface of mandibular first premolar. So you can also remember there are some other grooves, characteristic grooves. Mesial marginal developmental groove. Mesial marginal developmental groove. This groove is present in which tooth? Maxillary first premolar, permanent maxillary first premolar. So mesial marginal developmental groove for first premolar. Then we have palatoradicular groove. Palatoradicular groove is mainly present in maxillary incisors. Palatoradicular groove. Maxillary incisors. So you can get an MCQ question based on this as well. Mesial marginal developmental groove is present on mesial surface of maxillary first premolar, and palatoradicular groove is present in maxillary incisors, maxillary lateral incisor most commonly. This is on grooves. You can also get a question on cusp pattern. 2 cusp pattern is present in which tooth? 3 cusp pattern is present in which tooth? So 3 cusp is mainly seen in mandibular second premolar. Now again an image based question we have here. You can be asked, because this is important, based on the eruption timings. What is the age of the child whose OPG is shown in the image below? Is it 9 years, 10 years, 11 years, 12 years? So coming to this OPG, what you can appreciate here? Here we can see we have permanent incisors, maxillary as well as mandibular, right? Central and lateral, both. Permanent central incisor, permanent lateral incisor. But coming to canine, here we can see tooth jump for canine. Canine is erupting, permanent canine is erupting. And we have deciduous canine. We have deciduous molars and one permanent molar. Second molar is not yet erupted. Tooth jump for second molar is seen. Third molar also tooth jump is seen. So only permanent tooth we are seeing here are permanent incisor, central incisor, permanent lateral incisor and permanent first molar. Same here also we can see first molar, right? So how will you determine the age? Based on the last tooth erupting. Last tooth means last permanent tooth to erupt. So in this diagram, we have last permanent tooth as lateral incisor, permanent maxillary lateral incisor. And this lateral incisor, what is the eruption time for lateral incisor? 8 to 9 years. So our correct answer will be this. Same, we have a reference image for same OPG. Here you can see central incisor, lateral incisor, mandibular central incisor, lateral incisor. This are deciduous tooth. This is our permanent molar. So this is our reference image for the given OPG. You can see below our deciduous molars, there are premolars trying to form. Table, you should be thorough with the table. What is the calcification time? What is the time of eruption? What is the root completion time? You can get any question on this for both deciduous as well as permanent dentition. First calcification of primary tooth begins at the age of, you can be asked such questions. Now coming to the next question. Haplodont has single conical cusp, 3 cusp in a line, 4 cusp, or is it trichodont? Haplodont has mainly single conical cusp. Now what is this haplodont? We have mainly 4 phylogenetic classes of tooth forms. First is single cone, that is haplodont. Second is 3 cusp in line, that is trichodont. In line, remember, in line, trichodont. Then we have 3 cusp in a triangle, tritubercular triangle. And then we have 4 cusp in a quadrangle, that is quadritubercular. Please remember the 4 phylogenetic classes of the tooth form. We have diagram for the same. Here you can see single cone. So this will be haplodont. Here you can see 3 cusp in a line. So it will be in a line. They are present in a line. So it will be trichodont. Then we have 3 cusp in a triangle form. Here we can see triangle. So this will be tritubercular molar. And the last is, we have 4 cusp in a quadrangle. This will be quadrangle, right? So it will be quadritubercular molar. So which are the 4 phylogenetic classes? Single cone. You can be asked as an image-based question. Single cone, which is haplodont. 3 cusp in a line, that is tritubercular. 3 cusp in a triangle, that is three cusp in a line, that is trichodont. 3 cusp in a triangle, that is tritubercular. Trichodont in line. 4 cusp, that is quadrangle. Now coming to numerical based question. You just have to mug it up. You just have to remember this. This value can't change. So total volume of all the permanent teeth pulp is all. Remember this. It is not asking single tooth. It is asking all. So what will be the answer? 0.38 cc. All is 0.38 cc. But if it is asked for single tooth, then it will be 0.02 cc. Molar pulps are 3 to 4 times larger than the incisor pulp. Now next question is from our histotechnique. During tissue processing in histopathology, which of the following is used as a clearing agent? Is it 70% alcohol, formalin, absolute alcohol, or xylene? Our correct answer is xylene. Alcohol is dehydrating agent. It is mainly used during dehydration. Formalin, it is most commonly used fixative. 10% buffer formalin is most commonly used fixative. This is also an important MCQ question. Which is the most commonly used fixative? So which is the most commonly used fixative? 10% buffered formalin. Absolute alcohol again for dehydration. Xylene remains. So it is used as a clearing agent. What is clearing? Mainly removal of alcohol from the tissue. At the same time, allow the permeation of fluid that easily mix with the paraffin. Specimen is passed from alcohol through 2 changes of xylene. It is miscible with both alcohol as well as paraffin. It also helps in improving the refractive index. It allows the light to pass through, so it becomes clear. Hence, this procedure is known as clearing. What are the steps involved in this processing? First is fixation. 10% neutral buffered formalin is used. Next is dehydration. Ascending grades of alcohol are used. Next is clearing. Xylene is used for clearing. Next, impregnation in paraffin wax. Next come embedding. For embedding, Leucard's blocks are used. Leucard's blocks are used. L-shaped blocks. They are known as Leucard's blocks. Then we will do sectioning with microtome. And then staining. These are the basic steps for processing of formalin fixed paraffin embedded sections. You can be asked about frozen section, ground section. Next is our last question, that is keratinocyte cell migration from basal layer to the superficial layer is called maturation, proliferation, migration, or differentiation. It is maturation. Please remember this. It is not proliferation, it is not migration, it is maturation. So keratinocyte cells migrate from basal layer towards the superficial layer. And the time taken for the migration from the basal layer to the superficial layer is known as turnover rate. What is turnover rate? Time taken for the cell to migrate from the basal layer to the superficial layer. So these were the important questions. If you have any doubts, you can ask us. You can message on our Telegram group. We are always there for you. Good night. Keep going. Keep studying. All the best.